Started, ma'am.
All right. Just a minute. This is the final present CBME biochemistry presentation, and I think it's been a very fruitful journey, if I may say, because all of us have learned from each other, and we will continue to do so. This group is not going to really end. So, with that, over to Dr. Rohini Bhadre's group, group 7, to do the competency 11 presentation.
Okay, thank you, madam. This is group 7, which is going to present, and I will ask Dr. Sangeeta to present it, and I will just to start speaking on it. Dr. Sangeeta, can you go ahead? Dr. Sangeeta? Dr. Sangeeta, please unmute yourself.
Ma'am, doctors.
S. Sangeeta.
Ma'am, she's not joined.
She's joined, I think.
Ma'am, either she should just raise the hand, ma'am. Please, I'll unmute you.
Sangeeta Samudral.
Okay, ma'am.
Sangeeta?
Yeah. Yes.
Yeah, please unmute her.
Yeah, unmute her.
Good evening, ma'am. Sorry for the technical issue, ma'am. I'm extremely sorry.
Okay, we've got our
Is it audible, ma'am?
forum complete now, so continue. Yes, you are. Please continue.
Yeah.
Is it audible, ma'am? Shall I go ahead?
Yes. Go ahead.
Please go ahead.
Sorry for the delay, ma'am. It was a technical issue.
Continue.
Next slide.
Yes, ma'am. Next slide, please.
Yeah, okay, fine.
The slide is not getting changed, ma'am.
I've changed it. Can you see the next slide? Competencies.
We're dealing with the competencies 11.14 and 11.15. So competency BI 11.13, it deals with the demonstrate the estimation of SGOT and SGPT. 11.14, it is demonstration of estimation of alkaline phosphatase, and BI 11.15, it is describe and discuss the composition of CSF. Please change the slide.
I've changed.
So 11.13, demonstrate the estimation of SGOT and SGPT. So in this, the SLOs are explain the enzymatic reaction and its clinical significance, describe kinetic assay, use of spectrophotometric technique, and a known color development in the estimation. Then differentiate between endpoint assay and kinetic assay. Introduce the instrument used, whether it is semi-auto analyzer, auto analyzer, and the name of the machine is to be specified. Next slide. In this competency, we will be studying about the method used, principle, reagents provided, and preparation of working reagent, sample with an implication of hemolyzed, icteric, lipemic samples, and proper centrifugation of blood. Then we'll be dealing with the procedure, then calculation of enzyme activity and factor used, and unit of enzyme activity, the linearity of the assay, the reference range, and the system parameters. The principle of this estimation of SGOT or AST is SGOT or AST catalyzes the transfer of amino group between L-aspartate and alpha-ketoglutarate to form oxaloacetate and L-glutamate. The oxaloacetate, which is formed in the reaction, reacts with NADH in the presence of malate dehydrogenase to form NAD. The rate of oxidation of NADH to NAD.
Can I just intervene for a minute? You need not read out the principle. You can just tell us that the principle will be sort of short.
Okay. The activity is measured as decrease in absorbance, and it is proportional to the activity of the enzyme in that particular sample. Next slide. Similarly, for SGPT, it is also a transamination reaction. It involves the transfer of amino group, and in this, the
That's
rate
all.
of the reaction is monitored
because we
by.
don't. Excuse
Yeah,
me.
can I
Listen.
move to the
There's
next
no
slide?
need for us to. Yes.
Okay, ma'am.
Because
Absorbance
it's a
is
long.
measured at 340. And in this, describe the diagnostic importance of the enzyme or isoenzymes, and it is not certified. Teaching learning method is practical. The time allotted is 2 hours, and the assessment is graded and viva voce. Next slide. 11.14, it deals with the demonstration of ALP. Explain the enzymatic reaction and its clinical significance. Next slide. In this, we'll be dealing with the method used, that is paranitrophenol method, principle, reagents and preparation of working reagent, sample, procedure, calculation of enzyme activity, and the factor used, linearity, reference range, and the system parameters. Next slide. This is the principle related to the estimation of ALP. Here there is an increase in absorbance which is proportional to the activity of ALP in the sample. Paranitrophenyl phosphate describe the diagnostic importance of the enzyme or isoenzymes. Teaching learning method is practical. Time allotted is 2 hours. Assessment is graded and viva voce. 11.15, it is describe and discuss the composition of CSF. In this, the SLOs are define cerebrospinal fluid, describe the formation and circulation of CSF briefly, mention the sample collection of CSF, describe the physical characteristics and chemical composition of normal CSF in health and disease, list out the analytes routinely estimated in CSF, in lab and their normal values, mention the changes in cellular components of CSF in cancer, tabulate the various physical and chemical changes in CSF in various disorders. So this table shows us the composition of CSF in health and various diseases. And the teaching learning method is small group discussion. Duration is 1 hour. Assessment is SAQ, MCQ, and viva voce. Thank you, ma'am. I once again apologize for my delay.
Okay.
Oh, that's fine. Absolutely fine. We were also waiting for the people to join. And don't worry, very well. Thank you so much. And are there any comments on this? Would anyone would like to say something regarding 11.13 to 1415? I think quite a few of us are here today. As pointed out by some people, we have some people have not put in the slides. Please put up the slides in the CBME Biochemistry. Yeah, and then over to the next presenter.
Okay, can I just push this?
Rohini, yeah, you can just.
Yeah, I switched off mine.
Yeah. Normal CSF in health and disease. I think Dr. Nibriti is saying we should also mention the normal CSF in health and disease. And indications, Sugandhi has said we should add the indications for CSF analysis.
Okay, ma'am.
Yeah. So please
Definitely
add those
include
points
the
and then put it up as a final copy.
Okay, ma'am.
Yeah. Thank
Okay,
you.
ma'am. Definitely. Yeah. Okay. Thank you, ma'am.
My screen is gone, na, madam?
Yes, it's gone.
Yes, ma'am. Ma'am, actually, Group 8 presentation, I have sent the mail to Bedi, sir.
Okay.
Oh. Neha, can you see it?
Ma'am, no.
Okay. Do you don't have it at all?
No, ma'am, sir has not
It is
sent.
there, ma'am.
Okay, then share it, na? Doesn't matter, Neha. She'll share it now.
How to share it, ma'am?
Ma'am, is it your screen going on? Dr. Sangeeta, is it your screen going on?
No, my screen, Dr. Rohini's screen was there, but I have cancelled my screen now. I am not sharing my screen any longer.
Screen.
So it is UHS, I think.
So, ma'am, who wants to share?
Dr. Sridevi will share her screen.
Okay,
Ma'am,
ma'am.
how
Yeah,
to share the
Dr.
screen,
Rao,
ma'am?
Dr. Pradnya Rao is here.
Wait, ma'am, I'm doing, ma'am. Yeah, Dr. Sridevi, please share the screen now.
Is it visible, ma'am?
Yes,
Yes.
yes.
Yeah, it's visible. Make it a
Shall I start, ma'am?
screen. Yeah, make it full screen.
Okay.
Yeah.
Yes, ma'am. Shall I
Yes,
start,
you
ma'am?
can begin. Yes, start.
Good evening. I, Dr. Sridevi, professor in the Subaya Institute of Medical Sciences, Karnataka, will be enlightening regarding the practical competency BI 11.16 on behalf of Group 8 under the stewardship of Dr. Pregna ma'am and guidance of Dr. Sukanya ma'am and all other exuberant members of the team, Dr. S.K. Yadav, Dr. Sindhu, Dr. Shubha, Dr. Sonal Sogani, Dr. Sonali Mishra, and Dr. Shyam. The competency BI 11.16 is observe the use of commonly used equipments, techniques in biochemistry laboratory, including pH meter, paper chromatography of amino acid, protein electrophoresis, thin layer chromatography, polyacrylamide gel electrophoresis, electrolyte analysis by ion selective electrodes, arterial blood gas analyzer, ELISA, immunodiffusion, autoanalyzer, quality control, and DNA isolation from blood or tissue. The overlapping competencies with this competency are BI 11.1, describe commonly used laboratory apparatus and equipments, good safe laboratory practice and waste disposal. BI 11.2, describe the preparation of buffers and estimation of pH. BI 11.5, describe screening of urine for inborn errors and describe the use of paper chromatography. BI 11.19, outline the basic principles involved in the functioning of instruments commonly used in the laboratory and their applications. Now, SLOs for competency BI 11.16. By the end of the session, the student should be able to, regarding the pH meter, identify and note regarding the uses of the pH meter, explain the principle of pH meter, understand the operation of the pH meter with the use of standard pH solutions for calibration and explain the applications of most commonly used buffers. Understand the handling and maintenance of the pH meter. Now coming for the electrophoresis, the SLOs are identify and know regarding the uses of electrophoresis apparatus, define and explain the principle and the support medium used for electrophoresis, explain the uses of different types of electrophoresis, understand the procedure, indications, and visualization of protein bands in serum protein electrophoresis. Explain the factors affecting the rate of migration during electrophoresis. Explain the principle and applications of agarose gel protein electrophoresis for separation of normal and abnormal serum samples. Explain the principle and application of polyacrylamide gel electrophoresis for separation of the proteins and interpret the given electrophoretogram. For chromatography, the SLOs are identify and know regarding the uses of chromatography chamber, explain the principle and applications of chromatography, explain the uses of different types of chromatography, explain the retention factor, Understand the procedure for paper chromatography of amino acids using standard amino acid mixtures and urine samples. Understand the thin layer chromatography of amino acids using standard amino acid mixtures and urine samples, and interpret the given chromatogram. Now, SLOs for ELISA. Identify the ELISA reader. Explain the principles and applications of ELISA. Explain the different types of ELISA. Understand the procedure and materials needed in the ELISA testing with quantitation using plate reader. Interpret an ELISA report. Now coming to the SLOs for electrolyte analysis by the ion selective electrodes. Identify and know regarding the uses of ion selective electrodes. Explain the principle and uses of ion selective electrodes. Understand the types of ion selective membranes used in ion selective electrodes and know its advantages and disadvantages. Understand the serum electrolyte analysis by ion selective electrodes and explain its applications. And interpret the report of electrolyte analysis. Coming to the SLOs of ABG analyzer, identification of the ABG analyzer, understand the indications, contraindications, components, sample collection, the choice of site, procedure, and complications of blood gas analysis on ABG analyzer and explain its applications. Interpret a report of ABG results. Now coming to the SLOs of auto analyzer, identify and know regarding the automated or integrated analyzer and semi-automated analyzer. Understand the functioning of auto analyzers and describe the principles and advantages of auto analyzers in clinical biochemistry laboratory. Enumerate the uses of these equipments in medical practice. Next is immunodiffusion. Understand the immunodiffusion technique, that is radial immunodiffusion and Aucher-Loney double diffusion, and explain its uses and applications. Coming to the SLOs of quality control, explain what is quality control, explain the concept of good laboratory practice in terms of quality and reliability of lab results to minimize random and systematic errors, explain the terms of pre-analytical variables, sensitivity, specificity, accuracy, precision, mean and standard deviation. Explain the concept of pre-analytical, analytical, and post-analytical stages in lab and connection between patient management and laboratory quality. Explain the use of Levy-Jennings charts and Westgard's QC rules in clinical biochemistry laboratory. For DNA isolation from blood or tissue, explain the competence of isolation of the DNA, understand the pre-procedural steps, requirements, procedure of isolation of DNA from the blood or tissues, describe the applications of DNA isolation. For competency BA 11.6, estimated teaching hours is 6 hours. For teaching learning methods, the demonstration of the equipment, the demonstration of the working of the equipment, and the demonstration of the results, and lab visits. Assessment methods are MCQs, short answer questions, Viva, QC charts, and OSPI. Since we didn't have students since March, we have sent the recording of chromatography, electrophoresis, and DNA isolation in practical sessions. We have covered ELISA and quality control in theory classes in Medwiz platform. We have not assessed any of the competencies online. In KMC Mangalore, they also sent a recording of chromatography, electrophoresis, and isolation of the DNA in practical session. They showed the recording of the arterial blood gas analysis done in their clinical biochemistry lab. As the faculty were explaining, the entire process was recorded and shown as a video, and most of them wrote in their record books. But there were a few students who had not taken their record books home. So they also have not assessed any of the practical competency, but planning to keep them as OSPI or response station. I conclude by emphasizing the importance of quality as a part of diagnostic team. The motto, the quality reports, is always a balance between precision and turnaround time should also be incorporated among ourselves and our students. Thank you.
Very nice, well done. I think there are just a
Thank
few
you.
suggestions on CBME biochemistry. I think this was your institute did a wonderful job of video recording the practicals and sending it to the students. We too have sent them videos, and I think that is the need of the hour, and that is what all of us should do. Rise to the occasion of this unexpected situations. So with that, over to CBME group 9. You will have to move out of the screen, unshare the screen.
Devi, you have to stop sharing your screen.
How to log out of this, ma'am? Stop sharing.
Just close the PPT.
Escape, press escape button on your laptop or wherever. Press escape button.
It's not taking, ma'am.
Do right click
Double
and
click
put
on the
end
slide.
show. Right click and do end show.
Yes, ma'am.
Yeah. Okay, close down now, PPT. No, red cross.
Yes, ma'am. Close
No,
now, ma'am.
you haven't stopped sharing. Close this. Okay, and somewhere you will see a small square with a cross on it. Stop sharing your screen. Otherwise, leave the meeting and rejoin.
Yes, ma'am. Stop
Leave the
showing
chat
screen. I
and
have
then
given. Okay, ma'am.
Okay.
Yeah, thanks. Now, Neha, you will have to make Vidya, Dr. Vidya Patil as the
Right, ma'am.
presenter.
Right, ma'am. Dr. Vidya, please share your screen, ma'am.
Yes, ma'am. Am I audible, ma'am?
Yes,
Yes.
ma'am. Oh, ma'am, you are on mobile.
Are you able to see the screen?
Vidya, ma'am, are you on mobile?
Are you able to see? Yes, yes.
Ma'am.
On mobile?
Ma'am? Yeah, ma'am, I think she's on mobile, ma'am. She won't be able to share her screen.
Oh, Vidya, you have to be on your laptop. Okay, wait, I think I'll share the screen. Otherwise, is Sunanda there?
Hello.
Sunanda is there?
I'll just check, ma'am. Ma'am, full name of Dr. Sugandha?
Sunanda.
Sunanda.
Can you see my screen?
Yes, now
yes.
we can see.
Ma'am, is it Dr. Vusikala Sunanda?
Here.
Yeah.
Yes, madam. Yes, yes.
Yes. Good. Yeah, so Vidya, continue.
Are you able to see the screen?
Yes, we are
Yes.
able to see, and you can continue.
You are able to see my screen now, madam. Should I operate from my system?
Yes. Operate and Vidya Sunanda, no? Yeah, and Vidya, you can yes. Please start speaking.
Good evening to all. Greetings from Group 9. I thank Sucheta madam for giving me a chance to present for this final session. I would like to start
Vidya, we've lost you. Yes. Okay, yeah.
by thank you slide.
Yes, continue.
It's coming, ma'am.
It is.
Yeah, I would like to start with the thank you slide because that is the last session what we are having today. And I would like to thank all our mentors, Sucheta ma'am, all the organizers and my fellow co-learners for giving us such a wonderful learning experience. So our competency for today is BI 11.7, which tells explain the basis and rationale of biochemical tests done in the following conditions: diabetes, dyslipidemia, myocardial infarction, renal failure, gout, proteinuria, nephrotic syndrome, edema, jaundice, liver diseases, pancreatitis, disorders of acid-base balance, and thyroid disorders. So when we discussed all together, we decided on to present one or two of these in detail so that we can have an idea on how to conduct these sessions with our experience. So we'll go ahead with two of these, one on diabetes and one on proteinuria. So for the competency telling it on the diabetes mellitus, we have framed the following specific learning objectives. That is, at the end of TL session, phase 1 MBBS student should be able to list various biochemical tests used in diagnosis of diabetes mellitus, list various biochemical tests used to monitor the control of diabetic status, explain the basis and rationale of GTT, GCT, tabulate the WHO and ADA criteria for diagnosis of diabetes.
Vidya, 1 minute, you have to change the slide.
Yeah, madam.
Yes. Yes.
Yeah. The first SLO lists various biochemical tests used to diagnose diabetes mellitus. Second, list various biochemical tests used to monitor the control of diabetic status. Explain the basis and rationale of GTT, GCT. Tabulate the WHO and ADA criteria for diagnosis of diabetes mellitus. Explain the basis and rationale of glycated hemoglobin to monitor diabetic status. Explain the basis and rationale of microalbuminuria to evaluate renal function among diabetics. Discuss the biochemical basis of dyslipidemia in diabetes mellitus. Describe various laboratory investigations done in acute complications of diabetes like ketoacidosis and hyperosmolar coma. So till this we have suggested the domain as K and the level of competency to be knows how. Further, interpret the given lab report of patient with type 2 diabetes mellitus. Correlate the laboratory evidence with clinical picture in the given case report. Justify the importance of choosing correct investigations in given case scenario of diabetes mellitus. Plan the laboratory investigations to be done in a given case scenario of diabetes mellitus. So these we thought it would be at shows and shows how level. The teaching learning method would be a case-based discussion, and assessment methods would be OSPI, VIVA, OC or case chart interpretations. So how to choose some of the cases for these SLOs? Like for example, the first one, if we interpret the given lab report of a patient with diabetes, we can use either a case of freshly diagnosed diabetes, uncontrolled diabetes, gestational diabetes, or diabetes with acute complications, or similarly things like that. For the second one, to correlate the laboratory evidence with clinical picture, the same cases can be used. Now the next one, to justify the importance of choosing correct investigations in a given case scenario of diabetes, we can make cases in such a way that we can add irrelevant investigations or remove the relevant ones and then ask them to justify. Like for example, diabetes with ketoacidosis without ABT investigations, or uncontrolled diabetes of long-standing duration without HbA1c test reports, or something like that. Now, for the last one, to plan the laboratory investigations, it has to be made simple because they are first year students. So we can think of like an obese person with family history of diabetes having polyuria. What investigations would you like to suggest? Like that, a patient with diabetes since last 10 years with a history of chest pain on exam, we could expect them to add on lipid profile. A pregnant lady with a history of PCD, wherein we can go in for GTT or GCT. So these are some of the example case scenarios where we can address and evaluate each of these SHOSAV level competencies. So that is with diabetes. Next is on proteinuria. So explain the basis and rationale of biochemical tests done in proteinuria. So here the objectives SLOs are to describe the role of kidneys in urine protein excretion, describe various biochemical. Hello? Hello?
Yes, go ahead.
Am I audible, ma'am?
Yes, yes.
Yes, you are.
Describe various biochemical tests for quantitative and quantitative detection of proteinuria. Objectives used to collect 24-hour urine sample. Describe the procedure for collection of spot urine, 2 hours urine, 24 hours urine, and timed urine samples. Tabulate different grades of proteinuria by turbidity and multisticks. Discuss the basis and rationale of measuring urine albumin excretion, albumin creatinine ratio, and protein creatinine ratio. List various physiological and pathological causes for proteinuria. Identify and interpret various lab tests for proteinuria. We are here at S and SH level. Differentiate between glomerular and tubular proteinuria. Differentiate between overflow and secretory proteinuria. Discuss the basis of orthostatic proteinuria and post-exercise proteinuria. Discuss the basis of proteinuria in nephrotic syndrome, glomerulonephritis, diabetic nephropathy, and lower urinary tract infection. Discuss the importance of urine protein electrophoresis in differential diagnosis of proteinuria. This is not routinely done, but some information can be given. Interpret and justify the basis and rationale of test for Bence-Jones proteinuria at SH level, and grade proteinuria by observing the lab test and interpret the results in given case scenario. For this, we think of using few for teaching as well as assessment, like a case chart interpretations of nephrotic syndrome, diabetic nephropathy, hypertensive nephrosclerosis, or glomerulonephritis can be created, both for teaching as well as assessment. Or we can go in and show actual urine sample with proteinuria, how it looks like, and go on for an OSCE station or ask them to identify what is there, what's the appearance, and to interpret that. Or we can give some placards like this which show the normal glomerular basement membrane, abnormal glomerular basement membrane, and ask what is the reason for proteinuria there. We can go with the laboratory tests like pattern of urine protein electrophoresis and try to tell them the differences between tubular and glomerular proteinuria. Same can be used for even assessment also. Finally, we can explain the basis and rationale using flowcharts like that, and we can also tell our students to create some concept maps addressing this pathogenesis, cause and effect of proteinuria in different conditions. So all these different tools can be used for both teaching and assessment of proteinuria. So that's all we have prepared with the two conditions on diabetes mellitus and proteinuria. I think we can formulate in a similar way for all the other conditions and think of newer teaching, learning and assessment methods. I thank all our teammates and Sucheta ma'am for giving an opportunity here. Thank you, ma'am. Thank you. Over to Sucheta.
Thank you, Vidya. Thank you so much. This is, a lot of effort that was put in by her, and of course, all the other teammates also pitched in. Thank you. So we have the last presenter now.
Morning में अगर हो जाए ना, I'll try to get up in time.
Dr. Bedi is has to be muted.
I've done that.
Next, CBME 10, Group 10.
Ma'am, whom to be unmuted?
10, I think, Rohini, who has to be unmuted?
Neela Patil.
Okay, ma'am.
Neela Vaidya, sorry.
Neela Vaidya.
Thank you.
Yeah, thank you.
Ma'am, she will share her screen also. I have to make her the presenter.
Presenter.
Yes, presenter.
Hello, can I share my screen?
Yeah.
So I think you can hear my voice.
Yeah, but
Is it okay?
yes.
Okay. So good evening to all of you. On behalf of Group 10, I will take privilege that I will present Group 10 for the competency 11.23 and 11.24. My group members are I already displayed on the slide. So all I have contributed for this presentation, and I'm going to present what in our institute, some new slides, and also along with me, the presenter Dr. Reena Mahendra has shared few slides with me. The group facilitator is Dr. Rohini Bhadre Madam. So I start with my presentation. So the competency 11.23 and 11.24, both these competencies we can align with the nutrition topic, which was very well presented by the group 8. That was the 8.1 to 8.5, that is a nutrition. Okay, so it is just a extension of that activity. I want to say that. So competency is calculate energy content of different food items, identify food items with high and low glycemic index, and explain the importance of these in diet. And 11.24 competencies enumerate the advantages and disadvantages of use of unsaturated, saturated, and trans fatty acids. So being a core competency, all these points will be discussed in detail. With the nutrition topic, then lectures for the nutrition 8.1 to 8.5 already has been discussed. I will not repeat that again. But the teaching method, what will be the preferable one, will be the small group discussion or the SDL or the role plays or EC. Okay, so EC is already discussed in the nutrition topic by group 8. So I will go to next slide. SLOs for the 11.23. At the end of the session, phase 1 student should be able to define calorific values of proteins, lipid, and carbohydrates. Then calculate energy content of common food material by using standard charts. The charts are available, so they can use it, they can convert that grams to the finally to the 100 grams and all. Then define glycemic index. Already we have done this in the nutrition topic. Then enlist the common food items with their energy content and glycemic index. Then to understand the importance of glycemic index and calorific value in planning the diet for pregnant women, children, and patients with diabetes mellitus, protein energy malnutrition, obesity, and cardiac diseases. Then we can add a ETCOM also in this, communicate the importance of these nutrients to the above patients in empathetic manner. Then for SLOs 11.24, at the end of the session, phase 1 students should be able to differentiate the common food items as sources of unsaturated, saturated, and trans fatty acids. Enlist the advantages and disadvantages of using unsaturated, saturated, and trans fatty acids in daily diet. Then should be able to communicate the importance of saturated, unsaturated, and trans fatty acids in planning the diet for pregnant women, children, and patients with diabetes mellitus, protein energy malnutrition, obesity, cardiac diseases in empathetic manner. So we have already discussed it. So we have prepared the spots. Okay. So spotters or the spots which we can take it in a small group discussion. Also, we can convert this into the MCQs or the Google form for the formative assessment, or in the summative we have the MCQs. Also, we have the spots in the practical. So we can convert it into anyone is the option. So we can ask them to arrange the following food items in high to low order for their energy content, and we can give them the 10 or the 8 to 10 food items. Then this we have done in our spots. We have already discussed this online with the students. What is the glycemic index of food? This was the this was the one question. And food source A or B will be advised in diabetic patients, and why? So they must understand the role of glycemic index, and in the diabetic patient, which food should be supplemented in the diet or in the dietary management. Then also we can convert it to another one, define glycemic index. Then what is the glycemic index of given nutrient? And for diabetic patient, what additional nutrient you will suggest to change the glycemic index of this? So you, by taking the history of patient, they can follow this in the dietary management or dietary planning, that they can advise some additional nutrient in that. Then in the same line group, this is shared by Dr. Reena. Group the following food items with high to low glycemic index. So hierarchy they can give in the MCQ also. We can ask them, or we can ask them to write in the SAQ or the in the Viva also. We can ask them, give them the 5 nutrients and ask them to arrange it like that. So we can go for the next one. We can show them the images and all in the spots, then the good source of component of nutrient in the given photograph, or what is maximum recommended allowance for this nutrient. So they must able to say this less than 30% of the total dietary fat. Then we can show them the saturated and unsaturated fatty acids, fatty food. And we can ask them about the advantages and disadvantages of saturated fat. Same thing for the unsaturated fat. What are the advantages and disadvantages? So in a spot, we can ask them, give the important example of each one, or they can write down the advantage, one advantage and one disadvantage on the basis of the priority. Okay, or I will say importance. Then we can ask them to group the following food items in the saturated, unsaturated, and trans fatty acids. So this will be a type of a sorting. So they can use the standard charts for that. Already we have discussed this in the nutrition lectures and all. So they can arrange it in, we can ask them to segregate it into the saturated, unsaturated, and the trans fat. Then this oil is a good source of which fatty acid? We can ask them, or what are the two advantages of using this oil in the diet? So in addition, not only the PUFA and all that, they should add one more component of vitamin. So this is additional or some higher level question we are asking them. Then we can ask them what is the average glycemic index of the sources shown in the image. So, or what is the average RDA of this in the diet. So this part can be added. We can show them the picture what they are fond of nowadays, which type of fatty acids are predominantly present in given food source, and what are the disadvantage of this if preferred in the diet. So these are the few examples of the spots which can add. So now, thanks to all of you. So, any questions related with this, you can ask me. And this dietary plan, we can, in the integration, we can combine with the nutrition chapters which are taught in the community medicine, then also in the ANC clinic with the pregnant women, also with the children in the pediatrics. Okay, and for others in the medicine. So general medicine alignment is vertical alignment is already shown, but for the ANC people, ANC women or the women who are visiting the antenatal care clinics or the children in the pediatric OPD, we can advise or we can make a scenario in a role play, and we can give the advice to them empathetically and all that. So such type of role plays we can arrange in a small group discussion. So with this, I thank all of you for giving me the opportunity to present. Okay, so I stop my presentation. Yes.
Thank you
Hello.
so much. Yeah, I'm so glad that you could, make it different from what we've earlier seen, because quite a lot of this competency was already covered in the main competency. So thank you.
Yes.
Now the floor is open.
And that's
We
why I have
will
not
take
repeated
another
anything.
5 minutes. Yes, excellent, excellent. I'm very happy about that. You can now.
I want.
Yes, and now you can. Would I think all of us can have voice their opinions. This is today's the last day, and we have Dr. Sanjay Bedi here and Neha also. Thank you so much, Dr. Bedi, for giving us this platform. I think you're doing a absolutely wonderful job. I would request if anyone else would also like to say a few words. Dr. Nibriti, hi, good to see you, Sanjay. So thank you. We've really done a lot of learning. And I think we can unmute Dr. Nibriti and of course any of the other attendees who would like to say something.
I don't see Dr. Nibriti.
Ma'am, sir, I have unmuted, ma'am.
Yes, he is there.
Yes, now I am unmuted. Yeah.
Yes. So I think half a minute or two, each one can just say something, and then we can have the attendees also say.
It had been a very gratifying experience. I would like to thank Dr. and Sucheta to have involved me in this exercise, which is very useful training package, and very nice interactions and good efforts put by all those who really took interest in the assessments and all the training programs. So it has been very good. And kudos to Dr. Vidi and Sucheta. I'm very thankful to all my group members, all the different group members. Interactions had been terrific, very good, and WhatsApp interactions had been very good. I try to share whatever I feel that good for the UG education, and also I love discussing. Many times I triggered the discussion so that discussion can follow. So it has been very enjoyable and very useful. And I would love to
So
do so.
Pradnya?
Yeah. First of all, thank you very much, Dr. Sanjay Baby.
I must say this has been a very I mean the biochem group, the way everyone joined hands and the kind of teamwork which has come up in biochemistry, I mean the Bonhomie is just wonderful, and they are all functioning like one mind. And this group, we don't intend to close it. There are many more things to be done, maybe in assessment, and there will be problems when the CBME is actually implemented. Then also, I mean, this will keep on continuing to grow as a knowledge vertical for biochemistry. Maybe in coming times, once we have got multiple verticals, anatomy, physiology, pathopharma, so we might do some integrated sessions also. And so for that, I mean, let the at least chit chat continue. I must thank Dr. Sucheta and Dr. Nibriti for their leadership. Dr. Pragna also has done a wonderful, I mean, the way she speaks, it's a voice of authority. Dr. Rohini, everyone has really participated, and of course,
Jyoti Batra and
Jyoti
Sahiba.
Batra. Yes, I mean, in fact, it all started with Dr. Jyoti Batra's prodding, and I'm very grateful to her. And then it continued with the ma'am, and हम थोड़े से लोग चले थे, एंड कारवां बनता ही चला गया. And we'll wait for some time, and if there is a scope, we can have a second session as well after somewhere in December.
Yeah, that really sounds great. But Dr. Baby,
pleasure.
hats off to you on this initiative that you have taken.
So
much.
That's all from my side.
Thank you very much.
Rohini, would you like to have a quick word?
Dr. Pragna, Dr. Jyoti there, Dr. Sahiba.
Rohini, Saiba, Jyoti.
Yeah. Yes, madam.
We'll just say a quick bye-bye.
Yeah, sure. And very I mean, I also learned so much during this whole process, and it benefited to both of us. It was a mutual benefit, I think. So very nice it was. Thank you, Dr.
Thank you so
Sanjay
much,
Bedi.
everyone. Thank you, everyone. And now, if any of the participants would, of course, we have the group and the WhatsApp wall. So I think we can continue sharing our views on that. So with that, should we call it a night?
Yes.
Dr. Bedi? Yes. So
Yes,
with your
ma'am.
permission, good night,
Yes.
everyone. Stay
Good
safe
night.
Good night.
and
Good
always
night.
be in touch. Okay? Bye-bye.
Thank you very much. Thank you all.
Well done all. Well done all.
Very well done.